Welcome to NurseEdScholar. So I'm gonna start by saying I have a question for you. Okay, if you see an abnormal lab and there's already a medication ordered, do you give it or do you stop? Because this is where a lot of nursing students and new nurses they get tripped up. Okay, so in this lesson, we're going to learn how to connect labs, medications, and fluids to decide the next best step under pressure. Exactly the way the NCLEX experts expect you to know. All right, so let's begin. Now, on the NCLEX, you're rarely asked, what does this lab mean? Okay, instead, they ask you, what should the nurse do next? Right? So that means interpreting labs, evaluating medication safety, assessing fluid status, and deciding if you're going to hold, give, or question the order. This lesson is about patient safety, not memorization. Okay. All right. So the first thing that you're going to do is identify any labs that could be red flags. All righty. And this is before you think about medications or fluids. You ask yourself, is there a lab value that makes this order unsafe? So let's look at some, common red flag labs. And as you're going to notice, it's the same labs over and over again. Okay, number one is potassium. If potassium's high, the patient's at risk for lethal dysrhythmias. If the potassium is low, the patient is at risk for weakness and arrhythmias. Okay, when you're looking at creatinine, if that creatinine level is elevated, that means the patient is going to have impaired drug clearance. If the sodium is off, that can cause also rapid changes in sodium, that can cause a neurological risk. And if the calcium and magnesium if they're off, remember, they affect cardiac conduction and neuromuscular function. So the NCLEX wants you to know if a lab affects the heart, breathing, or the brain, pause first. Make sure that it's okay to give the medicine. Okay. I've said before, you can always hold something, but if you give it, you can't take it back. All right. All right. So number two, you're going to connect that lab value to the medication. Now, you have to ask yourself, does this medication worsen the lab abnormality? So let's look at it. High potassium. If you have a patient that has an order for ACE inhibitors, potassium sparing diuretics, or potassium supplements, the next best thing that you're going to do is hold the medicine and notify the provider. If you have an elevated creatinine, and the medications that you're given are nephrotoxic, okay, it's messing with the kidneys, or these drugs have to be cleared by the kidneys. If the creatinine level is elevated, the next best action for you to do would be to verify the dose and question the order. And understand there are some medications that can be, the dosage can be, changed because of a patient's kidney function. All right. And then the last lab would be a low magnesium. Low magnesium can worsen hypokalemia and can cause dysrhythmias. One thing that the NCLEX wants you to know is that magnesium must often be corrected before potassium will be normalized. So if your potassium is low and your magnesium is low, you know, contact the provider because they may tell you, okay, we'll give the magnesium first and then give the potassium riders. Okay. So now the third step is to assess fluid status. Now, labs and meds don't exist without fluids. Okay. So you're going to have to ask yourself, is this patient dehydrated? Are they overloaded or unstable? And cues you're going to look for um, is the patient hypotensive? Do they have tachycardia? Do they have poor urine output? Do they have edema? Or I mean, do they have lung crackles? Right? So then you're going to say, okay, based on the assessment findings, Is this patient dehydrated? Because if they're dehydrated, then that means that their labs are going to be concentrated. So this is where you'll see an unusually high H&H. But then if the patient is fluid overloaded, then their lab work is going to be diluted. So sometimes you'll see it on that CBC, that H&H will be really low. And you're like, what's going on? So you have to be able to see the connection of the lab work and the fluid status of your patient. Because fluids can correct labs, but it can worsen heart failure. And it can affect medication absorption and clearance. So that's why it's important to know the fluid status of your patient. And number four, decide what's the next best action. The NCLEX wants you to think in sequence. Number one, is there a dangerous lab value? Okay. Number two, does the medication worsen that lab value? Number three, is the patient stable or unstable? And number four, you're going to have to determine, is it safe to proceed to give the medication? Or should I hold it and notify the physician? Because you have to remember, nurses don't just blindly carry out orders. You know, if the order is unsafe, just because the provider ordered it doesn't mean you have to give. I'm going to say again, you can always hold the medicine, but once you give it, you can't take it back. Okay. And then you're going to have to deal with the consequences. So it's best for you to think this through because patient safety comes first. And questioning an order is a nursing responsibility. Okay. All right. So let's do some examples. You have a patient with chronic kidney disease, and they have a potassium level of 6.2. Now, there's an order written for spironolactone. So first thing you're going to have to ask yourself is, okay, is there a red flag? Well, the patient's potassium is elevated. So what does spironolactone do? Well, it raises potassium. So is this safe? Nope. And so what are you going to do? You're going to hold the medication and notify the provider. This isn't really about delaying care more than it is about preventing harm of your patient. Okay, number two, a patient is admitted with heart failure and has these following labs and orders. So their potassium is 3.1, their magnesium is 1.4, and there is an order for IV potassium replacement. All right. So ask yourself, is there a red flag? Yep. We have low potassium and low magnesium. And so then, based on this, what should I give first? Typically, it would be the magnesium. Why? You know, because magnesium is required for the potassium to move into the cells. So replacing potassium by itself will probably be ineffective and unsafe for your patient. So what's the next safest thing you're going to do? You're going to notify the provider and request a potassium rider. I mean, not potassium, sorry, a magnesium rider before you give the potassium rider. Okay. Because if potassium is low and magnesium is low, magnesium typically becomes first. You're going to give that first to your patient. All righty. All right. Our last one. You have a post-op patient that has the following assessment and orders. Their blood pressure is 88 over 52, so they're hypotensive. You have a heart rate of 118, so they're tachycardia. And you have a urine output of 15 milliliters an hour. Okay, they're not putting out. And their sodium is 150. Okay. Now there's an order for IV furosemide. So let's walk through this, right? What do the vital signs tell you? Patient has hypovolemia, possible dehydration. And what does the sodium level tell you? Well, the sodium's high. It's concentrated. So that's letting you know there's a fluid deficit. So what would furosemide do? Well, it's going to remove more fluid, and the patient doesn't have fluid to begin with. So that's going to worsen a hypotension and the kidney perfusion because you can see by the 15 milliliters an hour, they're not perfusing well at all. So is this a safe order? No way. Okay. So what's the best thing that you're going to do? You're going to hold the diuretic and you're going to notify the provider. You're going to always assess fluid status before giving diuretics. Okay. So let's do a recap. Whenever you are assessing and looking at your patient before giving meds, you're going to say, okay, is there a dangerous link? Does this medication that I'm about to give worsen it? Is this patient stable? So now do I proceed on giving it or do I hold and notify the provider? You're going to always do that with all of your patients. And so, key takeaways are your labs guide the safety of your patient because patient safety always comes first. Remember that medications can worsen instability. If the patient's already unstable, their situation is unstable, and you're giving meds that's going to make it worse, you have to be careful of that. Nurses have to question unsafe orders. That is our job. We are the last line of defense to the patient. Fluids, you have to remember, it changes everything, and clinical judgment, when you make those, that's why we harp on clinical judgment skills because memorization is not going to work with this. You have to be able to critically think because that's what the NCLEX rewards you on. Critical thinking, not task completion. Okay? So that is it. If this lesson helps you kind of slow down a little bit and think through safety decisions, our main thing as instructors is patient safety and for us to create safe and competent nurses. That is our goal. So please subscribe for the next lesson where you can apply this framework. We're going to do some NCLEX scenarios. Please go on NurseEdScholar.com. I have workbooks there, and I'm continually making workbooks to help you in studying smarter so you can test like a pro. So thank you again for watching Nurse Ed Scholar. And until next time, happy studying.